Hello, good afternoon, everybody. We are going live now with Professor Doctor Meriç Karacan from IVF Turkey to talk all about PCOS and endometriosis. So this affects so many women. Please have your questions ready. It's such an important topic. Both conditions are. And we're going to be doing a deep dive into symptoms, suggested treatment options, how this may impact fertility, you name it. So please don't be shy. Feel free to ask questions as we go along. That's what he's here for. We're very lucky to be linking up with IVF Turkey today and leaning on Professor Dr. Meriç's expertise. So let's see if he's here and we can start. Hi, welcome everyone. Nice to see you today. Hello, good afternoon.
Hello.
It's lovely to meet you.
I'm very happy to be with you today.
How are you doing?
Fine, thank you very much. How are you?
Yes, very well, thank you. Nice to see you. And I just introduced the topic, endometriosis, PCOS. Okay. Obviously, two conditions that impact a lot of women around the world. Please could you start by introducing yourself,
okay.
IVF Turkey, and then we've got some great questions to ask you.
Okay, I'm Professor Doctor Meriç Karacan. I've been working at the Orta Hospital in Turkey and a member of IVF Turkey team. I completed my residency in Turkey and did my fellowship in the United States in reproductive endocrinology. I've been in the field of infertility for almost 20 years, and particularly working in an IVF. So I'm dealing with PCOS patients and endometriosis patients for years. Ready to answer your questions right now.
Fantastic. Well, we're very fortunate to have your expertise today, so thank you very much for coming on for this live Q&A. As I just mentioned, for anyone who's joining or joined, if you have any questions, please do ask them, and Professor Dr. Karacan is very happy to answer them. So first of all, how about you explain what PCOS is?
PCOS is a condition where women do not ovulate in a regular fashion. The ovary is full of small cysts, small fluid-filled cysts. That's the reason it's called polycystic. In fact, it may be called as multifollicular ovaries. But the problem is, even though a woman has many follicles in her ovaries, she does not ovulate well. She does not throw egg at each cycle. That's the reason she doesn't get pregnant and has experienced irregular bleedings because of irregular ovulation. And together with that, ovaries produce high amount of androgens, which causes excess hair growth and obesity and some acne formation on the face of women. So it's a complicated disorder and found in almost 15% of women across the world. Genetical basis makes a difference. For instance, in Turkey, we observe 15 to 20% of women having PCOS, but in Europe, it drops down to 10%. So genetical inheritance makes a difference in the incidence of PCOS. It's a very common condition among women at reproductive age.
And are there any symptoms for PCOS?
Irregular bleeding is the main symptom, together with excess hair growth on a woman's face, body, and obesity is the other symptom. So these are the main symptoms. At reproductive age, these women, or women with PCOS, may have difficulty to get pregnant. So infertility is the other symptom at the reproductive age. The main symptoms, in other words, obesity, irregular periods, are observed at the early age. As she starts bleeding at the first menses, this disorder starts developing. So it can be diagnosed at very early age, at the age of 15, 16. At the first periods, this syndrome can be diagnosed. So my advice to women with irregular periods and obesity, they should be examined by a physician, and they should keep their body mass index within normal range. Because even if you sustain having normal body mass index, these symptoms may fade out or may disappear spontaneously. So this is a very the PCOS is a very wide spectrum from mild to the very severe cases. So even if you have normal body mass index, most of the symptoms may disappear. So it's very important to have normal body weight if you have PCOS. That's crucial.
And you mentioned obesity, being overweight, hair growth. Does everybody who has PCOS get those symptoms, or can it vary?
Yeah, it varies actually. If you have a polycystic ovarian appearance on vaginal ultrasound, it doesn't mean that you will have all these symptoms, obesity, irregular periods. If you have a normal body weight, you might not experience all these symptoms. So that's important. The lifestyle and your diet, exercise are very important factors affecting this woman's symptoms. Even if you have PCO, polycystic ovaries, if you are on a good track, if you are not obese, if you take care of your diet and you exercise, you get rid of many of these symptoms and live in a regular fashion. You might have regular periods. You can get pregnant on your own easily. But if you do not care these problems, these conditions, and if you gain weight, then your menstruation regularity will be disturbed, and then you'll have difficulty to get pregnant.
Do you see a lot of patients who suffer from PCOS at IVF Turkey? Do people come over for your speciality and for your support to get pregnant when they're suffering from this syndrome?
Yes, we have many patients coming to Turkey with the PCOS. Almost 10 to 15 of our patients, or 20 of our patients having female factor and having irregular periods have been diagnosed as having PCOS. So the main treatment option is to induce ovulation in these women. So if they do not get pregnant just with ovulation induction and intercourse, they are, advised to undergo an IVF cycle right away without losing time.
So am I right in saying you see patients who might be already diagnosed with PCOS, or you might diagnose them with PCOS, and you may initially see whether they can get pregnant naturally through Clomid or medication to bring on ovulation, and if that doesn't work, then the next step would be going into IVF.
Right, correct. So the first option is to get these pregnant with just using of simple ovulation induction agents, such as you mentioned, Clomid or letrozole, and then have them, have intercourse and try to get them pregnant naturally. If these modalities, these alternatives do not work, and then we advise them to undergo an IVF cycle. By doing IVF, we stimulate their ovaries and collect their eggs and fertilize them in the lab. So that's the last option. So the first option, always try to get them pregnant naturally.
Okay, that's really good to know. I think that if people, from what we've heard in the community, and if anyone out there feels like this, let us know. And also from your professional expertise, do you find that if someone gets a PCOS diagnosis, they immediately think that they won't be able to get pregnant.
Right. They can get pregnant naturally. Absolutely, it's possible for them to get pregnant on their own. But as I mentioned before, they should take care of their lifestyle. The main two key factors are healthy diet and exercise. Unfortunately, it's sometimes impossible to convince them to lose weight. Because of, if they lose weight, they can get pregnant easily on their own. But according to this recent studies, only 5% of women, so that low percent of women lose weight after the diagnosis of PCOS. So
Wow.
1 out of 20, unfortunately. So even though we know that this is a crucial factor, only 1 out of 20 women lose weight after the diagnosis of PCOS.
And if, whilst we're still on PCOS, if you're going down the route of IVF with you, for example, at IVF Turkey, then is it common for people who suffer with PCOS to produce more follicles?
Yeah. Would you please repeat the question? I couldn't catch there was
Of course. For PCOS patients who are undergoing IVF with you, is it more likely that they will produce more follicles?
Right. Since, as I mentioned, there are multiple follicles in a PCOS women. Normally, we observe 10 to 12 follicles on both sides in a normal ovulating woman at a reproductive age, 10 to 12. But in PCOS patients, this number may be up to 25, 30 follicles on both ovaries. So it's a tricky, cumbersome condition because we need to stimulate ovaries to get as many good eggs as possible. But sometimes PCOS women respond to medication vigorously, producing almost 20-25 follicles, making them susceptible to ovarian hyperstimulation syndrome, which is a life-threatening condition. And if it occurs, the accumulation of fluid in the abdomen and in the thorax, in the chest, might disturb women's health condition. So that's very important. So it's difficult to ovulate or stimulate ovaries in a woman with PCOS. Sometimes we do not achieve to get good eggs out of stimulation in that kind of women. And also in some cases, we do stimulate women, get eggs after aspiration, we retrieve eggs, but do not transfer the embryos because of the high risk of hyperstimulation syndrome. We freeze all of the embryos and transfer them in the frozen embryo transfer cycle. So that's the important factor.
That's really good to know. And the next topic we're going to talk a bit about is endometriosis.
Okay.
Before you explain to people what that is, for those who may not know or may think that they might want to get it checked out, because I know that it's a condition that can take a long time to get diagnosed, years for some people.
Right.
Why are PCOS and endometriosis often grouped together as conditions?
Endometriosis is, let me start by describing what endometriosis is. Endometrium is the name of the lining inside the uterus. But sometimes this tissue, namely endometrium, can grow as outside of the endometrium, such as in the ovary or in the behind the uterus, causing pain during menses and during the intercourse. So these are the main two factors the main two symptoms of endometriosis: painful intercourse and painful menstruation. And together with that, as time goes by, these implants, these endometriosis implants, endometriotic implants outside the uterus, might cause severe adhesions in the pelvic area, causing tubal obstruction. So endometriosis is consisted of three main symptoms: dysmenorrhea, painful menses, painful intercourse, and finally infertility. But these two first symptoms can be found in many women. That's the reason a lot of women delay the diagnosis of endometriosis. They don't go to doctors, and they don't get the diagnosis of endometriosis. Even if they go see their physicians, these tiny implants, tiny foci cannot be diagnosed with ultrasound or with any other radiologic methods. That's the reason we sometimes diagnose these condition later than women needed to.
That's really, really useful to know. Thank you very much. If anyone has got any questions around PCOS, endometriosis, everything we're talking about today, please feel free to ask. We're very lucky to have your expertise here today, Professor Dr. Karacan. And in terms of IVF Turkey, how do you support women who are struggling with endometriosis, and how do you reach a diagnosis?
The first attempt or the first line treatment is again to diagnose these patients. We do vaginal sonogram together with vaginal examination. In case we observe endometrioma, this is the cystic structure formed in the ovary because this bleeding happens each month. Since this blood cannot go out of the body, it accumulates in the cyst in the ovary, causing pain and discomfort in the lower pelvic area. So after the examination, if we diagnose endometrioma, this cyst, we talk about the next step. If the cyst is small and the tubes are patent, then we follow these women to get pregnant on their own if they are willing to get pregnant. But if they have symptoms of pain and discomfort and pain during intercourse, the surgery, laparoscopic removal of the cyst is always discussed or counseled with these patients, because it unfortunately deteriorates the quality of life of the women with with endometriosis. So diagnosis is the first step, then treatment is adjusted according to the patient's needs and patient's future plans.
And so what would be the general way that you would support an endometriosis patient at IVF Turkey with treatment? What would be the usual treatment plan?
If the tubes are patent and the sperm analysis is normal, we stimulate ovaries and try to get them pregnant on their own again. We wait them for getting pregnant on their own. But if this treatment doesn't work out, then we enroll these patients into an IVF program, stimulate their ovaries and collect eggs again, and fertilize their eggs outside the body. So the first line is the waiting for the natural conception. If it doesn't work out, IVF would be a good option. But in the presence of cyst over 3-4 centimeters causing pain, then first line treatment would be removing the cyst, removal of the endometrioma, and then enrolling all these women to an IVF program. So it depends on patient's condition and patient's symptoms.
Someone has asked, does stage 1/2 of endometriosis impact fertility and egg quality?
Yes, stage 2 endometriosis may impact fertility potential, disturbing the tubal patency. So this lady needs to be checked for tubal patency. If the tubes are not working well, she may be a good candidate to an IVF program. In terms of egg quality, there are many papers on the quality of eggs in patients with endometriosis. There are some papers saying that yes, egg quality itself may be affected, but some others say egg quality is no different from women without endometriosis. So in general, we do not accept that egg quality itself is impacted by the presence of endometriosis. So rather than egg quality, tubal patency is the major factor in patients with endometriosis.
Okay, that's really useful to know. Thank you so much.
You're welcome.
And in terms of success rates, what do success rates with IVF or fertility treatment look like for endometriosis and for PCOS?
It obviously, success rate obviously depends on two major things. The first one is the woman's age, and the second one is sperm quality. If the woman's age is less than 35, pregnancy rate is almost 40-45% per cycle for both conditions. But if the patient's age is over 40, pregnancy rate per cycle drops down to 15-20% for both conditions. So my message to our patients that do not delay, do not postpone your plans to get pregnant. So because age has a very important impact on the egg quality. And in addition to that, patients with endometriosis and endometrioma may suffer if they delay their treatment, because if endometrioma gets bigger, gets enlarged, they disturb this disturbs the ovarian environment, causing less oocyte, less egg retrieval. So age is the major factor in the success rate through IVF.
Really useful to know. Thank you so much. Someone has just said, and I'm not surprised because you are such a leading expert in this field, and everyone should get in touch with you and the team at IVF Turkey to find out more, especially around these conditions. Someone has said, what's the procedure to get in touch with you? So if you head to our link in bio, we've linked up the IVF Turkey website so you can contact the team. Feel free to DM them. Us, they'd love to help you. And also on the Sunday, the 27th of November, your team are in London offering free patient consultations and personalized Q&As. So please, again, reach out to the team. You can message us to be put in touch, or go to our link in bio, and they're more than happy to help. And I strongly advise people take up this free consultation opportunity because it's amazing. Do you have time for a question?
Okay. Okay. Is there any other question right now?
Yeah. Someone has said that they are 38. What would you suggest for someone with PCOS who has been put on BC, Mirena? Is that birth control? The Mirena?
Yeah, Mirena is birth control, right?
Yeah. Gained weight, told to lose weight, which is very, I know it's hard, but unable to, but the doctors, I believe, have been unhelpful.
After losing weight at the age of 38, it's kind of advanced, not advanced, but it's between age 35 to 40. We don't want to lose more time to undergo an IVF cycle. If they have been trying to get pregnant for like more than 2 years, at the age of 38, I would recommend them to use at least 3 to 4 months with ovulation induction and insemination, one or twice. If this method does not work out, then IVF would be the next option. At the age of 38, I strongly advise them not to wait for a long time to undergo an IVF cycle. You should act right away.
That's really good to know. Thank you. I've just put on there, someone has said, when is the consult happening in London? The day. I said Sunday, the 27th of November. So go to our link in bio to speak to the team, because you need to book in for a free consultation with the team. And you can find out more. And I so appreciate your time today. It's been really interesting, and I'm sure everyone's found it very educational. Thank you for answering those personalized questions too. Anything else you think that we should say as we finish on the topics today?
No, but again, I just like to emphasize that the age that does matter in the treatment of IVF. If you like to have a baby, please do not postpone your treatment, and go. If you have irregular periods, having pain during intercourse, having pain during menses, please go see your physician to rule out endometriosis. And after trying on your own, please go ahead and try an IVF cycle to get pregnant. Time is very important in both of conditions, because as time goes, ovarian reserve declines as oocyte quality. Please be careful about your age and go see your doctor right away.
Great. Do you have time for 2 more quick questions? And then I suggest that everyone follows our link in bio, books in for this fabulous day on the 27th of November for meeting the team in person to have your questions answered for free. So is surrogacy in Turkey legal or an option?
No, unfortunately not. Surrogacy is not legal in Turkey, but my colleague can advise them, can lead them to other countries for surrogacy, but surrogacy is not legal in Turkey.
What about someone with type 2 diabetes? Is it possible to get pregnant?
I couldn't understand the question.
Type 2 diabetes, is it possible to get pregnant?
Type 2 diabetes. So it's important to have normal blood glucose level in patients with type 2 diabetes. Yes, it's possible for them to get pregnant, but blood sugar level should be carefully regulated before they attempt to IVF cycle. Yes, they can get pregnant. Please take care of your blood glucose level. You should have these levels be regulated. And if you are obese, if you are overweight, please lose weight before attempt. It significantly will increase your chance of getting pregnant.
Amazing. Thank you so much.
Honestly, you're welcome. I'm delighted to be with you.
Fantastic. We've had so many questions.
Thank you very much. I'm looking forward to seeing you again. I'm very happy to be with you.
Absolutely. And for the person asking about surrogacy, please do get in touch with their team to find out more about options elsewhere, and also make the most of this patient meeting on the 27th of November. Head to our link in bio, and we look forward to speaking to you and the team at IVF Turkey soon. Thank you so much for your time today.
You're welcome. Thank you very much. See you soon. Bye-bye.
Bye-bye. Bye.